The findings were quite dramatic. So the same individual after EBV infection experienced over 30-fold increase in MS risk. Well, most importantly, we know that EBV is the leading cause of MS. So we know that a vaccine against EBV would almost certainly prevent the large majority, if not all, the cases of MS. If viral reactivation is driving the disease process, if we could eliminate the virus, we would really possibly stop the disease because we would eliminate the immune response against the virus itself. Hello, my name is Alberto Ascherio. I'm a professor of nutrition and epidemiology at the Harvard Chan School of Public Health and a professor of medicine at Harvard Medical School.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, a new sounding board for the MS research community and the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. At the start of 2022, there was widespread media reporting that Epstein-Barr virus had been discovered as the cause of MS. My guest on today's podcast, Alberto, is an expert in this field, and it was a publication in Science that originated from his group that was a catalyst for this media attention. We will be chatting to Alberto about the history of EBV research in MS, how his research and the studies of others have shifted the landscape about the proposed role of EBV in the development of MS, and what these findings might mean for the therapeutic landscape in the future and the potential benefits for people living with MS. Alberto, thank you for joining me.
Thank you for the invitation. It's my pleasure. And so the idea that the Epstein-Barr virus is related to mononucleosis dates back to the 1980s and was originated by observation of the similarity in the epidemiology of infectious mononucleosis, that is the clinical manifestation of EBV infection, and MS. So both diseases are rare in the tropics, are rare in Asia, rare in Eskimos. So they're remarkably similar. So this generated the hypothesis at the time. And also it was observed that people who have a history of mononucleosis have a higher risk of developing MS, about between 2 or 3-fold higher.
And I guess, as sort of said, there's been a long history of this. And even back when I was starting my MS research many years ago, the link between EBV and MS was being talked about. But at the time, as you say, it was the fact that there was an increased incidence of EBV in people living with MS than the general population. But the numbers in both were quite high. But what was sort of known beyond that incidence? What was sort of known at the time around that potential link between EBV and MS?
Well, the common interpretation was that this similarity and the association between mononucleosis and MS was due to the so-called hygiene hypothesis. The hygiene hypothesis postulates that children who grow up in a higher socioeconomic status and higher hygiene are not exposed to many infections in early childhood. So their immune system would be primed to more inflammatory responses and a higher risk of MS. And at the same time, because of the high hygiene, these children escape EBV infection and so are susceptible to mononucleosis. So the idea that high hygiene was a common cause for both mononucleosis and MS, and there was no direct link between the virus and the MS itself.
And I guess at the time, if memory serves me correctly around the numbers, our thought at the time was it was around 95% of people living with MS seemed to have been exposed to EBV, but it was probably high 80s, 90% of the general population were as well. But this changed, I guess, in the past few years. 2020, a large German study, and then obviously your studies as well. What sort of changed with that recent data, and why have they been so groundbreaking and shifted our potential thinking about the role of EBV?
Well, the big change has been our study you mentioned before in Science. And what is different about that for the first time, we were able to identify a large population of individuals not infected with EBV, young adults, follow them over time. The study lasted 20 years, and demonstrate that those who are not infected with EBV, they don't get MS. So the findings were quite dramatic. So the same individual after EBV infection experienced over 30-fold increase in MS risk. And these observations are very different from what had been observed before, that were like cross-sectional studies.
Mm. And I guess what was unique about the study and the cohort that you followed, these were US military veterans, I believe, and so you had samples across a period of time of their life, didn't you?
Right. They were active duty military personnel, not really veterans. So these are Army, Navy, and Air Force active duty young men and women who are followed from the time of recruitment, when they're usually 17, 18-year-old, and then their blood sample collected on average every 2 years. So you can know with some approximation, you can see when they were infected with EBV and when they started having symptoms of MS.
Yeah. And so I guess there was a couple of key findings out of that result. One was that I believe it was almost every individual in that cohort, and it was well over 900 people who had developed MS in that cohort, had been exposed to EBV. Is that correct?
Is correct in the sense that they were exposed to EBV before the onset of MS. So about 35 individuals who developed MS had not been exposed to the virus when they were first seen, when they were recruited into the Army or Navy or Air Force. But they became infected during the follow-up. And that is a key point, because before being infected, there were no cases of MS. Only after infection, we started seeing MS, except for one case. There was only one case in an individual not infected with EBV.
And I think what you touch on there is really some of the really elegant part of that study is your ability to look at biomarker neurofilament light in terms of pre-exposure to EBV and post-exposure. Can you just sort of outline what you saw with that part of the study?
Yes, absolutely. So a possible concern is that MS, being a disease of immune dysregulation, could make it more likely, even before the symptoms, could make it more likely that an individual acquire EBV. So the temporal, it was extremely important to establish the temporality, what comes first. So we use the neurofilament, serum neurofilament, as a biomarker, because serum neurofilament level tend to increase sometimes years before the onset of MS, so really an early biomarker of neurodegeneration. So what we found that before EBV infection, there is no sign of NFL elevation. So the NFL elevation consistently occurs after EBV infection.
And I guess, so after these studies came out, as I mentioned in the introduction, a lot of people, especially in the media, started saying that the cause of MS had been identified. Some of the other messaging around it, and I certainly remember hearing this at the recent ECTRIMS meeting as well, described EBV as being necessary but not sufficient to cause MS. Can you sort of summarize what our current thinking is about how EBV may be involved in the development of MS?
Yeah, I think we need to clarify a bit the concept of causality. So for me as an epidemiologist, there is not the cause of any disease. All the diseases are caused by multiple contingencies. This is really at the core of our discipline, and that is true for everything. So what we say that EBV is the leading cause of MS, meaning that, if you don't get EBV, you almost virtually you get no MS. You will rarely, very rarely, there will be some cases, as we've seen in our study, 1 in 800 cases was EBV negative. Now, this statement that EBV is necessary but not sufficient is, it's a bit bizarre, because saying that EBV is necessary is saying that is the cause of all cases of MS, basically, because it means if you don't have the virus, you have 0 cases of MS. So it's a stronger statement to say that EBV is necessary than to say that EBV is the leading cause of MS.
Yep.
And the second part, saying that it's not sufficient, is stating the obvious. I mean, there is no virus that is sufficient for any disease. SARS-CoV-2 is not sufficient to cause COVID-19. Poliovirus was not sufficient to cause poliomyelitis, or the human papillomavirus to cause cervical cancer. So this, sufficiency cause doesn't exist almost for any disease that we know of.
And I guess that's a really important point, because for people living with MS, for example, who have been told for a really long period of time that we're not going to be able to get a cure for MS until we understand the cause, hearing in the media that the cause has been discovered, I think it's really important that we are very clear about what role EBV is playing, as you say.
Well, most importantly, we know that EBV is the leading cause of MS. So we know that a vaccine against EBV would almost certainly prevent the large majority, if not all, the cases of MS. Mm-hmm. What is less clear is what is the role of the virus in driving the disease process, right? Yep. So are we still in time? Is getting rid of the virus, assuming we can get rid of the virus, are we still in time, or is it too late once you have MS? I believe there is reason to hope that eliminating the virus will improve, if not cure, the disease, but there is no certainty there. So I want to make clear there is no certainty.
Yeah, definitely. So I guess in terms of, we've identified that it's playing this role as a leading cause of MS. In terms of how it's going about doing that, in terms of the mechanisms, do we have a clear idea yet how EBV may be playing a role as a trigger? I know there was some work coming out of Stanford just after your work was published, sort of around the role of molecular mimicry with a myelin protein.
Yeah, there are different hypotheses, but there is not a clear answer. So the group in Stanford is proposing a molecular mimicry, and that is a hypothesis that has some credibility, but there is no consensus. Molecular mimicry means that the immune response against EBV cross-react with protein in the brain, and that is the cause of MS. And alternative hypotheses exist. So an important hypothesis that was proposed even a few years ago is that the virus actually reactivates in the brain. So there are EBV-infected B cells that cross the blood-brain barrier, reactivate in the brain, and the immune response against these reactivated virus, that is what causes MS. Mm-hmm. Those are two of the major hypotheses, but there is also the possibility that EBV transform B lymphocytes, being an oncogenic virus, and that would be, a mechanism that would not be vulnerable to antiviral treatment.
So on those two, with the molecular mimicry hypothesis, what sort of data has been found around that in terms of have immune cell subsets, T cell or B cell subsets that do cross-react between parts of EBV and parts of myelin being identified?
In a subset of patients, in the series studied in Stanford, about 30% of the patients had antibodies against an EBV protein called Epstein-Barr nuclear antigen 1 that were found to cross-react with a protein expressed also in the brain that is called glial CAM. Now, the mm-hmm. existence, the cross-reacting antibody doesn't prove that the antibody themselves are causing the disease. Also, they were able to reproduce a similar mechanism in an animal model. But this seems to explain only a subset of the cases in that series.
And I guess with the other hypothesis around the reactivation, you mentioned that EBV tends to reside in B cells. Is there any thought that could be why B cell therapies have proven to be effective as a treatment in MS?
I'm sorry, you say B cell therapy, like
anti-CD20? Anti-CD20, yeah.
Right, anti-CD20 drugs basically act as an antiviral in some way because they deplete the memory B cells that are the site of persistence of EBV. So a possible mechanism that could explain the effect of anti-CD20 that they eliminate EBV from the circulation. So the efficacy of the anti-CD20 go in favor of the hypothesis that targeting the virus would help individuals with the disease, with MS.
Okay. Now, putting you a little bit on the spot, but do you have a personal opinion around which hypothesis you think is more likely? Or do you have a thought as to where this may end up?
Yeah, at this point, I really think that the viral reactivation is gaining more credit. And this is because still in 2022, there is an important paper that was published on T cells and the T cells against EBV. This was done in a large consortium of investigators that pooled data from multiple centers. They have over 1,300 MS cases. And they found that a major difference between individuals with MS and matched controls is that individuals with MS have more cytotoxic T cell, specifically recognizing the lytic EBV antigens. And this is something that you wouldn't observe unless there is a lytic EBV reactivation in individual with MS that is not seen in control. So I think that paper convinced me, in addition to the previous pathological work that was, there was no consensus on the pathology, on the presence of the virus in the brain. But this investigation, even apparently more indirect, is quite compelling that the immune response, the T cell response against lytic antigen of EBV point toward the lytic reactivation as a major mechanism.
Okay, fantastic. Thinking about that idea and the fact that reactivation may be a key driver of this mechanism, and previously you talked about the fact that a vaccine against EBV, an effective vaccine against EBV, may help prevent the majority, if not all, cases of MS. And feel free to elaborate on that as part of this response as well. But what's the potential therapeutic goals of using EBV as a target for people currently living with MS?
Yes, for people with MS, if viral reactivation is driving the disease process, if we could eliminate the virus, we would really possibly stop the disease because we would eliminate the immune response against the virus itself. So it's a big if because we don't have a way to completely eliminate the virus, but I think that there is actual hope that could happen.
And so there are, if I'm correct here, there are a couple of trials underway. One, I believe, in the US and one here in Australia as well, that are looking very early stages at ways of doing that. Can you talk about how they're going about trying to completely clear the virus from people living with MS?
Well, the trials I know of, one is the trial of cytotoxic T cells against EBV. That is still at a pretty early phase. I'm not sure. I have to admit, I'm not a specialist in this therapy, so I cannot say what is the probability that you can really eliminate the virus with. I know some people are a bit skeptical about whether you can completely eliminate the virus, but we will see. The trial is ongoing. The other approach is antiviral drugs. These have the advantage of being oral treatments. And to my knowledge, the current antiviral drugs have some effect against EBV, but it's unlikely that will lead to a complete elimination of the virus. Mm-hmm. So what people are trying to get is a proof of principle. Say, can we show that targeting the virus causes an improvement in MS, even if we're not curing the disease? That mm-hmm. would give us more certainty that the EBV is a valid therapeutic target, basically. Then we should build on that to find the more powerful drugs.
Okay. And do we have any early, even just very preliminary results about the use of these antivirals in people living with MS to get some guide as to whether or not we do see any benefits?
No, I believe we don't have any preliminary results yet. Years ago, there were trials done with other antivirals that very modest effect against EBV, and the results were borderline. So we're not really sufficient to, decide one way or another. But those drugs were much less powerful than the drugs that we have today against EBV.
Okay, very interesting. Well, we look forward to seeing those results when they come out. Maybe we'll see some at MS Milan later this year. So what do you think are the next steps for research into EBV in MS?
Well, I think that there are three areas. One is the vaccine against EBV, and I know some companies are pursuing that. The second area is work that we are trying also to do. Can we identify which individuals respond to EBV infection in a way that is predictive of a high MS risk? Because if we can identify these people before they develop MS, that would be a big advantage in terms of trying to prevent MS. And the third area is really the therapeutic. And the therapeutic include the antivirals and also the possibility of a therapeutic vaccine. So an example I give often is the herpes zoster vaccine. That is given to people who are infected with the virus to prevent shingle, that is a reactivation of the herpes zoster. So at least in theory, it may be possible to have a vaccine that prevents EBV reactivation, even if we don't get rid of the virus.
Okay, fantastic. And I guess as sort of the last question here, what sort of time frame do you think, and it's a terrible question to ask because I know it's almost impossible to answer, but what sort of time frame do you think we would be looking at to have some idea as to whether or not this may be a viable approach?
I would be happy if 5 years from now, we have, solid answer to some of these questions. I would be thrilled if it happens before, but I think 5 years is a reasonable estimate. Yeah.
Okay, fantastic. Well, thank you very much, Alberto, for joining me today. It's been fascinating to listen to your insights on this topic.
Thank you. My pleasure.
And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and also co-founder of MS Translate, a science communication initiative bridging the gap between people living with MS and MS research. You can read more about this topic and more on the website ectrums.eu. Do subscribe to the Ectrums podcast on iTunes, Spotify and Apple Podcast, and follow Ectrums on Twitter, LinkedIn and YouTube.